Hello everyone, my name is Charlie. I am a junior at the University of Nebraska-Kearney studying communication disorders. So this video I am making is for preschool language disorders, and it is about the case study project. So if you catch me looking down at all, it's just because of the notes I have written down, and so that is the only reason I will be looking down at all. As you can see, I have some quality handwriting here that I will be referring to. So in this situation we have Tony. Tony is 3 years old with another 6 months as well, so he's 3.5, and his pediatrician has been trying to get his parents to take him to an SLP for a couple of years, and so that's kind of a big red flag that, okay, why is this? So maybe one thing that I would first do is ask the parents, well, why haven't you taken him? Maybe it was an economical thing. Maybe they didn't have enough knowledge about speech language disorders, but also the child has a history of OME, so that's otitis media effusion, or chronic ear infections. So that might have impacted his hearing. There is some mixed research on that. So some researchers think that OME impacts a child's language development, some do not. I personally would go with my gut feeling, and I kind of feel like, it might not be proven, but there is some research for it. So I would say that consideration of how the OME might have affected his language development would be important. That is especially true because he has some issues following directions, and he also only says about 100 words vocabulary-wise. So that's kind of a big problem, because when you look at 2-year-olds, 2-year-olds are typically able to say about 200 words, and he's 3.5, so almost 4. So I would take a look at his medical history, his economic background, but also be careful not to discriminate. Just kind of ask the parents questions, but also maybe ask, hey, is there anyone else I can talk to in your family, or something like that, if you really feel that you cannot fully trust the parents' opinions, although I feel like that case is pretty rare. You could also continue to ask teachers or other caregivers. The teacher here at the daycare is saying that he's having some social issues and she can't handle him in the classroom. So one thing to consider when analyzing how his social behaviors is, well, is it because of a social issue that he's just not getting, so maybe issues with pragmatics or receptive language, or is it also just that maybe the classroom is too big, maybe he needs more of a one-on-one ratio or a smaller group to work with. So if the daycare is really, really big, maybe consider putting him in a smaller daycare, and that sort of thing, or maybe just assigning someone to kind of hang out with him and make sure he's getting social interaction. I'd also consider the fact that he is an only child, and his parents work outside the home, so maybe being an only child and having parents work outside the home might mean that, again, he's just maybe not getting enough of that social interaction. I would also, again, as I mentioned before, look at medical history. That includes psychological history as well. So I would say that it is very important to know, hey, did any of your family members have any language disorders? Did any of your family members have any sort of psychological or psychosocial developmental issues, such as autism, which can impact language development as well? So that's an important thing to keep in mind. Again, pre-assessment is very important, because if you just go ahead and assess a child and see, oh, they're having issues maybe following directions, but you don't know that maybe they have a hearing problem, that is just going to try to treat the symptom, and when you only treat the symptom and not the problem, it's going to cause other issues. For example, I personally have never had a language disorder. However, I do have ADHD, and I thought for the longest time that I had anxiety because I had symptoms of anxiety. And so whatever I did, the problem didn't just go away, And so that was because we were treating the symptom, not the problem, which is the ADHD. So again, pre-assessment is very important because we need to rule out other factors that may be contributing. And when you pre-assess a child, just because they have other issues doesn't necessarily mean that they don't also have a language disorder. However, it's very important to just know that there might be other issues causing those problems. So then, what I would do is, after that, as part of the pre-assessment process, I would use Tomlin, Weissmer, and Weiss's 1996 two questionnaires that they came up with that can be used by speech-language pathologist clinicians. So there is the curricular competencies checklist, and that kind of looks at academic and social communication issues in the classroom. And then the second one is the speech-language service delivery checklist, and that just is something that SLPs can use to kind of see, what might this problem be, what might the treatment look like, and kind of what the conversation skills are of the child. So again, pre-assessment, very important. It's also just important to do any type of screening before you do a standardized assessment, because again, if you are treating the symptom and not the problem, you are going to run into issues later. So then, the test that I chose to do on the child is called the Clinical Evaluation of Language Fundamentals, or the CELF-P2. And so the reason I picked that is because the resource I looked at, that I will have linked below in the video, shows that children who are 3 should be kind of starting to be able to use the skills on this test. So this is tested a lot on 3-year-olds and up, and there is another test that I would consider doing that could qualify them for services. I'm trying to see what it was called. I am totally blanking on what it was called. I will write that in the description below. However, it's just really important to make sure that a child who is really struggling qualifies for services, especially if the parents don't have the capabilities to pay for it themselves. My thought process is, just because maybe the parents don't want to work with the child, that doesn't mean that the child doesn't deserve any success, and it doesn't mean that teachers or speech pathologists should give up on the child. So again, just using that test, I think, would be beneficial for insurance purposes. And so that test also uses 7 subtests. There are 3 main subtests. There's word structure, sentence structure, and expressive vocab to understand the child's core language score. But there's also other subtests that include concepts and recalling sentences, basic concepts and word classes. So those kinds of things are very, very, very important, because if a child is having issues recalling sentences, if the child is maybe not understanding directions and that kind of thing, I mean, it's not necessarily that the child is acting up, and we, again, need to make sure that the child is having the best resources available to him. Even if you think he's a difficult child, does not mean you should give up on them. So, yes. The next thing I wanted to point out is that in this test, there are some different examples I found on that same resource that listed the test. So, there is one example that has to do with sentence structure, where there's 4 pictures, and there's a picture of a girl and a dog in each picture, and one of them has a dog with spots on it. So if you say, point to the girl that has a dog with big black spots. And so by saying that, you allow the child to show you what they know and what they're able to comprehend. And that works with sentence structure. With expressive vocab, that's important too. You can point to a picture, maybe a girl is riding a bike, and you can say, what is the girl doing in this picture? And the child has the opportunity to explain. And then another category, again, was recalling sentences. So maybe just asking them to repeat what you said, and then also just say you have one that has, let's say there's a picture with 3 bowls. One is filled with apples, one has a couple apples, and one has no apples, and you tell the child, point to the one that has no apples in the bowl. So saying stuff like that or testing those kinds of qualities is very important, because you can see if the child really has some emerging skills in these areas, or if he is really, really far behind. And so I think it is important to assess for where they should be at first, and then to help them qualify for insurance. And then if they really just cannot do that test, maybe do a simpler test. So yeah, and there was another one that was called the preschool, that was what the other test was called. So it's called the preschool language scales test that works on birth to age 5. So I would use that if the CELF proved to be too difficult for the child. But I think starting out at the highest level would maybe help see, okay, this kid is really struggling. So then you can use that to show to insurance companies so that the child can get covered. And then if that, again, is still really just the child is just really far behind, just go down a test. And you can also use that for insurance purposes as well, and use that maybe to help the child figure out, or help the parents and figure out what is going on with the child. That one also has an auditory component that the CELF does not. So while I am saying to use the CELF, I would also recommend maybe doing both that and the preschool language scales test. So just kind of basing it off the client, what you think is of the utmost concern, just to make sure that they are getting those skills developed sooner rather than later. And then again, just seeing what sort of issues are going on that maybe aren't necessarily related to just a language disorder, but also maybe other factors, again, that I mentioned, such as maybe a psychological developmental issue, or a medical issue. As mentioned before, the child had symptoms of OME. So yeah, hopefully you learned a lot in this video, and thank you.